So friends, let's start our last topic for today, that is the mnemonic on men's syndrome. Guys, just 1 second. I'm so sorry. Okay. Yeah. So let's start the mnemonic for the men's syndrome. Men is multiple endocrine neoplasia. बहुत ज़्यादा questions आते हैं और बहुत ज़्यादा confusion होता है इसके ऊपर. So let me make it simple for you. Okay, so let's crack NEET PG, friends, and myself, Dr. Apoorva Mittal, and I'm your mentor for anesthesia, and I'm taking other subjects also on this prestigious platform of Unacademy, and do use my referral code, that is Apoorva Live. Okay, and you know why? To get 10% discount on the Plus and the Iconic subscription. Let me quickly tell you how to get the advantages of the Unacademy platform. You just have to install the Unacademy learning app on your mobile, and by just installing and by using my referral code Apoorva Live, okay, you can unlock the free facilities which are present, like free special classes, live doubt clearing sessions, and also the live test and quizzes. And also you can get the Plus or the Iconic subscription. Plus subscription में भी आपको live classes मिलती हैं, but most important is these batch courses which have the structured schedule. This will really help you out in the Plus subscription. And don't forget to use my referral code Apoorva Live to get 10% discount on this subscription. The Iconic subscription you have along with the Unacademy advantages we are associated with the prep ladder, video lectures hai, question bank hai, revision very very important, and handwritten notes. तो इसमें दोनों सब्सक्रिप्शंस में, okay, the Iconic subscription and the Plus subscription, if you apply my code Apoorva Live, you will get 10% discount on these courses. Okay, guys, is my audio and video clear? So let's start our today's topic, that is men's syndrome. पहले मैं एक बार देखना चाहूंगी how much you remember about the men's syndrome. So let's start with a question. Okay, a 20-year-old male, okay, 20-year-old male presented with chronic constipation, headache, and palpitations. On examination, he had marfanoid habitus, neuromas of the tongue, medullated corneal nerve fibers, and nodule of 2:2 centimeter size in the left lobe of the thyroid gland. Now, this is the case of, what is this case of? A, sporadic medullary carcinoma of thyroid, B, familial medullary carcinoma of thyroid, C, MEN2A, or D, MEN2B. So what should be the answer for this? एक 20-year-old मेल है, क्रॉनिक कॉन्स्टिपेशन है, हेडेक है, पैल्पिटेशंस है, marfanoid habitus है, न्यूरोमास ऑफ द टंग, मेडुलेटेड कॉर्नियल नर्व फाइबर्स, नोड्यूल है 2:2 सेंटीमीटर का, लेफ्ट लोब ऑफ थायराइड. ये किसका केस है? Guys, what is this case of? Is it A, B, C, or D? Anyone? Okay, so fine, I'll give you the answer. Chronic constipation, headache, palpitations. This is showing features of what? It is showing features ki patient pheochromocytoma. Okay, pheochromocytoma, which is disorder of what? It is a disorder of the adrenal medulla. ठीक है, एग्जामिनेशन पे दूसरा पॉजिटिव पॉइंट, मार्फेनॉइड फीचर्स, न्यूरोमास ऑफ द टंग, ठीक है, न्यूरोमास ऑफ द टंग, म्यूकोसल न्यूरोमास है ना, एंड नोड्यूल 2:2 centimeter, लेफ्ट लोब ऑफ द थायराइड. मोस्टली इट कैन बी द medullary carcinoma of thyroid. So what are these features of? These are the features of MEN 2B. The answer is D. Now, how do we remember this? How do we remember this? Can anyone tell me? So, first of all, men. Okay, men syndrome. Men syndrome, it is what? It is multiple endocrine. Okay, endocrine neoplasias, right? Neoplasias. ठीक है एंड मेन हर समय मेन क्या होते हैं मोस्टली दे आर डोमिनेंट सो इट इज ऑटोसोमल डोमिनेंट ठीक है नाउ दिस मेन इज डिवाइडेड इनटू मेन 1 ठीक है एंड मेन 2 okay the men 2 is further divided into two types what are these are 2A and 2B अब इसको याद कैसे रखा जाए what are the features of men 1 what are the features of men 2 or 2B just remember men is all about M and P's men syndrome is all about M and P's तो जो men 1 है इसको कैसे याद रखेंगे इसको ऐसे याद रखेंगे हम लोग 1 को हम लोग और कैसे लिख सकते हैं this okay this is also what is it primary okay primary so men 1 is associated with 3 P's it is only associated with primary that is 3 P's so men 1 you have to remember that it is 3 P's from the primary it is associated with 3 P's. Now, what are these 3 P's which are associated with men? Okay, सबसे पहले it is the parathyroid. Okay, the parathyroid gland. Okay, दूसरा is the pancreatic. Okay, pancreatic tumors, and तीसरा it is the pituitary. Okay, pituitary. Okay, is it clear? So the 3 P's which are associated with men 1, which is also known as Werner's, it is parathyroid, okay, parathyroid, pancreatic and pituitary. Now parathyroid is associated with what? Calcium regulation. And so it can be hyperplasia, or adenomas. और एडिनोमास तो इसकी वजह से क्या होगा देयर विल बी इंक्रीज इन द कैल्शियम लेवल and in this in men 1 hyperplasia of the parathyroid is the most common one. Now the pancreatic tumors, okay, it can be pancreatic polypeptides, ठीक है, polypeptides which is most common. उसके बाद the others are pancreatic what? Pancreas से क्या क्या secrete हो रहा है? Islet cell tumor, pancreatic islet cell tumor. So gastrinomas, right? Or pancreatic, is it clear? Insulinomas. या फिर glucagonomas. तो कैसे याद रखेंगे हम लोग? Men 1 is what? 1 को कैसे लिख सकते हैं? 1 primary. So men 1 is only associated with 3 P's, that is parathyroid, pancreatic and pituitary. Pituitary, it can be anterior pituitary or posterior pituitary. So Cushing's के features या फिर acromegaly. ठीक है? So all these are the features of men 1. Is it clear? Any doubt in this? सबसे ज्यादा foremost is the parathyroid, then pancreatic, and least common is the pituitary tumor. So this is men 1. ठीक है, that is Werner's. 3 P's, primary से 3 P's. Now, men 2A. इसको कैसे याद रखेंगे? Remember, everything is about P's and M's. तो 2A. A को हम लोग अगर इसमें सिर्फ एक हम लोग इसको ऐसे देख ले, so this resemble P, so men 2A, which is also known as Sippel syndrome, is 2P and 1M. Okay, it is 2P and 1M. Is it clear? So what are the 2 P's? Which is associated with this is 2 P's. एक तो पैराथायरॉयड, ठीक है, पैराथायरॉयड। और दूसरा है रिमेंबर फियोक्रोमोसाइटोमा, फियोक्रोमोसाइटोमा, ठीक है। रिमेंबर दिस फियोक्रोमोसाइटोमा, इट इज अ कॉमन फीचर ऑफ मेन टू, ठीक है। एंड हाउ विल यू रिमेंबर पैराथायरॉयड? पैराथायरॉयड किसके पीछे रहता है? थायराइड के पीछे, ओके। पैराथायरॉयड किसके पीछे रहता है? थायराइड के पीछे। यस डॉक्टर विनय, इट इज पैराथायरॉयड एंड फियोक्रोमोसाइटोमा, एंड 1M is medullary cell carcinoma of thyroid, so this is 1M, which is 1M, ठीक है। Is it clear? So 1M and 2P's, तो अगर thyroid related है तो उसके पीछे क्या है? पैराथायरॉयड, so that will also be related, and other is pheochromocytoma, that is meant 2A, ठीक है, that is the Sippel syndrome. So 2A, that is 2P, ऐसे लिख लो, so it is 2P and 1M. Is it clear? Is it clear? Any doubts in this? Any doubts in this? Now men 2B कैसे याद रखेंगे? men 2B कैसे याद रखेंगे? तो B को हम लोग और कैसे लिख सकते हैं? B को ऐसे, C, इसमें से क्या आ रहा है? एक ही 3 आ रहा है, ठीक है, और 3 को हम लोग ऐसे ऐसे देखेंगे तो इट इज M, सो इट इज एसोसिएटेड विथ 3M. इज इट क्लियर? 3M plus 1P, ठीक है, दैट इज meant to be, ठीक है। meant to be में 3M और 1P है। सो व्हाट इज 1P? मैंने क्या बताया था? meant to में कॉमन फीचर क्या है? दैट इज फियोक्रोमोसाइटोमा, ठीक है, pheochromocytoma. And what are 3M's? What are 3M's? Let me change the color. Oh, I'm so sorry. Okay. What are 3M's? Can anyone tell me what are 3M's? Yes, one is medullary cell carcinoma of thyroid. ठीक है, और दूसरे M क्या है? These are marfanoid features. Marfanoid features. Marfanoid features क्या होते हैं? The man is very tall, right? The arm span is more. Okay. So tallness, arm span is more. And one more thing, very important, there are high chances of aortic dissection in these. So Marfanoid-like features. Okay, Marfanoid-like features. And what is the third M? Can anyone tell me what is the third M? Yes, Dr. Vida, it is mucosal. Remember, it is mucosal neuromas. It is mucosal neuromas. ठीक है? So neuromas will be present. So mucosal. So it can be oral. It can be on the tongue. The whole intestine. It is mucosal. So intestinal neuroma. So these are the 3M and 1P of meant to be. Is it clear? समझ में आ गया? How to remember? So men 1, how will you remember? Primary, है ना? इसको कैसे लिख सकते हैं? 1 को ऐसे भी लिख सकते हैं, that is primary. So it is associated with 3P's. What are the 3P's? That is parathyroid, pancreatic and pituitary. ठीक है, पैराथायरॉयड में hyperplasia is most common. pancreatic islet cell tumors of the pancreas. So polypeptides, gastrinomas, insulinomas and glucagonomas and VIP nomas. ठीक है, VIP nomas. Also pituitary में it can be anterior or posterior pituitary, so that is Cushing's and acromegaly. ठीक है, meant to A को और कैसे लिख लोगे? ऐसे P जैसे, तो it is 2P, right? 2P and 1M. I'm so sorry, what? ठीक है, so it is 2P and 1M. 2P से क्या है? Parathyroid and pheochromocytoma. Pheochromocytoma is a common feature for both meant to A and meant to B and medullary cell carcinoma of the thyroid. ठीक है, थायराइड के पीछे ही पैराथायरॉयड ग्लैंड होता है, सो देयरफॉर पैराथायरॉयड. meant to B, B को कैसे लिख सकते हैं? 3, so there are 3M plus 1P. only one P. So it is pheochromocytoma, medullary cell carcinoma of thyroid, marfanoid-like features, and mucosal neuromas. Okay? So that was the men, the mnemonic for men syndrome. I hope this was clear. That was all for today. See you tomorrow at 1 p.m. on YouTube for the rapid revision of medicine with me, Dr. Apoorva Mittal, on YouTube. Let's crack NEET PG for autoimmune diseases. Take a quick revision of autoimmune diseases through MCQ session. A very, very important session. Is it clear? Okay, and do use my referral code Apoorva Live to get 10% discount on the Iconic and the Plus subscription. Okay, and on the Telegram, many people are asking me t.me/Apoorva04 anesthesia. Okay, this is my link on the Telegram channel. Do join me on the Telegram channel to know about the further classes, and always you can ask your doubts through this. Thank you and have a nice day.